Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone.
Morning.
How are you today?
I'm fine.
Before all, please host for share screen. First of all, introduce myself. My name is Risna Fitri Yulistiani. I'm from Nursing Studying Program. Well, here I will present a journal article from reading report assessment from Mrs. Wildan Nurul Aini. Here I will present a journal article with the title Nurses Moral Distress in Emergency Department by Rani Arinda Ayu Prawesti and Every Widianti. The vital of nurses is taking action related to their moral belief, makes nurses' moral comfort not exhibit and affect their dissatisfaction is their work. Perhaps it also can result in nurses' distress. The purpose of this study was to identify moral distress in the emergency department nurses. Next. Consists of several parts, namely, in part 1, introduction, in part 2, method, in part 3, result, in part 4, discussion, in the last part, 5, conclusion. Next. Strike to the first part, that is introduction. Become an emergency room nurses is challenge for nurses because emergency room nurses must act quickly and must immediately handle patients with different situations. Therefore, emergency room nurses experience a moral dilemma regarding action. Moral dilemma experience when there is a difference between the nurse's diction and action that becomes a moral stress. Next. The cause of moral distress in nurses are grouped into 3, including number 1, clinical situation, number 2, nurse internal constraint, and number 3, internal constraint such in institutional policy by Hamrick, Boscher, and Epstein, 2020. Next. Basically, an vulnerable patient needs skilled and appropriate care, but nurses cannot always provide all service needs for a number of reasons and have an impact on nurses and institutional moral distress. The purpose of this study was to identify moral distress in emergency department nurses. Next. In the part 2 method, this study used a quantitative descriptive method with a cross-sectional approach. The population is emergency room nurses in Type A hospital in Bandung City with 51 respondents. Data collection in this study questionnaire questionnaire consists of the character of the respondent, age, gender, length of work experience, emergency department, educational levels, special certificate, and religion, and the statement to be measured is moral pressure. The next. In part 3, result, you can see about PowerPoint. Table 1, Describe the character of the respondent, and the most respondent is female, 72.1%, and the highest age, 33.3%, in the age range of 35 to 39 years. Number of respondents with diploma 3 and bachelor education level almost same. And 13.9% have a special certificate such as PPGD, ATLS, and HELS based on work experience. More nurses with different jobs, more than 10 years experience as a nurses, 66.7%, and emergency room nurses, 61.9%. Most respondents actively participate in religious activities, 77.85%. In the table above is the result of tabulation for responder characteristic. The next. Table 2. The result of this analysis show that the moral pressure experienced by low emergency nurse, vulnerable score 3 to 189, frequency of nurses experience moral pressure, pictured on MDSR item, rarely with score vulnerable 6 to 63, and the intensity of disturbing the nurses enough with vulnerable score 1 to 66. The next. Table 3 describe the item in the MDSR sorted from highest to lowest frequency. The next. Table 4. There are additional items from a responder with who have frequent experience and are disturbing MDSR item, including number 1, a patient are motivated to go home by medical personnel. Number 2, a critical patient and handled by residents who are not yet competent. The feature of the MDSR instrument includes to open question with the option yes or no, answer which I am the determinant and impact of moral distress, including the intention of nurses to quit their jobs because of moral distress. The next. Table 5 show that as many as 27% of respondents answered yes, indicating that 12 respondents considered quitting their jobs due to moral distress but could not do so, and currently there were 3 responders who were considering quitting their jobs. Next. In the part 4 discussion, moral pressure began witnesses when experiencing moral difficult situation. Then the nurses can determine a decision to take action according to moral, but apparently to action can done according to perception. The nurses' inability to act cause psychological imbalance and ill feeling. The effect this condition cause coping behavior that arise in nurses. By March 2016, Wilson, 1989. However, this study did not find how to cope with the used emergency room nurses. In the part 5, conclusion. The research showed the moral distress in emergency department nurses tend to be low. A cause of moral pressure has a difference compared to previous quantitative research. The moral pressure may not be removed, but anticipation can be done for convenience. Nurses at work can continue to be improved and minimizing the nurses' intention to quit their jobs. Nurses have their own coping when experiencing moral pressure, but based on the result of study are not known to be emergency nurses coping. Future study will done by knowing the nurses coping in the face of moral pressure. Okay. Okay, my presentation is finished. But before that, do you have any question?
Yes, any question?
Yes, Vanessa.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Introduction, my name is Fadisa Firiski. I want to ask, what is a good moral concept for nurse? Explanation, please. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you, Vanessa. Very good question. Answered. Good moral concepts are obtained when nurses have a moral commitment to patient, can be an advocate for patient, have moral sensitivity, able to understand complex moral situations. So nurses tend to experience moral certainty in the exercising their moral autonomy and make the nurses intent to do the right thing. Nurses who are able to demonstrate their moral competence and make appropriate moral judgment will lead nurses to moral comfort. Is the answer understandable, Vanessa?
Yes, understand. Okay, thank you.
Welcome. Anyone want to ask again? Okay, I closing the presentation and thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.